Hi, I'm Seth Wolk. I'm the System Chief Medical Officer at Spectrum Health. I'm also the President of Spectrum Health Medical Group. Today I'm here with Courtney Lane. Courtney is a nurse practitioner who leads the Spectrum Health Lung Cancer Screening Program. Courtney, thanks for coming in and spending some time with me.
Thanks for having me.
So the lung cancer screening program, relatively new. What is it? What's it all about?
Yeah, it started in March of 2015, and pretty simply it's a low-dose CAT scan of the thorax that we do for people who are higher risk, which is basically people over the age of 55 and smoked at least 30 pack years in their life. It is a U.S. Preventive Service Task Force recommendation for all people who are higher risk for lung cancer and meet the screening criteria. So it is covered by insurances as long as they meet that criteria. And the aim is really to help diagnose lung cancer at an earlier stage. So lung cancer is the deadliest cancer that we have. Kills more people every year than colon cancer, breast cancer, and prostate cancer combined. So doing these CT scans is really a chance to diagnose cancer at its earliest stages when it's most curable, before people are even symptomatic of lung cancer. The lung screening trials have shown us that there's a decrease in death from lung cancer by about 20% with doing this screening. Our service itself has diagnosed about 4 cancers, 3 at early stages, 1 unfortunately at a later stage.
If I'm a primary care physician and I'm just learning about this, how do I get a patient plugged in to have this service?
So referrals can be made either in any way that you'd make another referral, and it comes to our referral coordinator. We give them a call and talk to the patient directly. Primary care providers have the option of following up on the CT scans, or I can be the person that follows up on the CT scans. So our nurse coordinator makes sure that they meet all the criteria, that they've smoked enough years in their life, that they're of the certain age and their medical history fits what the service guidelines are. And then if everything works out, that they meet the criteria, then if the primary care office is going to follow them, they send it back, say it's okay to schedule. They have to get prior authorization from the insurance. If we're going to follow them, we take care of getting prior authorization. We schedule all the CT scans and get them arranged. They also come in and meet with me personally before they even have the CT scan. It's called a shared decision-making visit. During that visit, we talk about the risks and the benefits of doing the screening, because some people, there are some risks that there is radiation exposure. There is high false positive rate. We detect nodules in about 30% of the population. And we talk all about those things beforehand. The other nice thing about sitting down and talking to the patients directly is getting to know them, but we also talk about their smoking history and their desires to quit smoking if they're still actively smoking. I'm trained as a tobacco treatment specialist, so I can help people meet their goals of quitting smoking. I provide prescriptions for medications and follow-ups as needed too. We've started a smoking cessation program that's a nice parallel with this program to help people reach their goals. So it really aims at reducing the root cause of lung cancer, so early detection in combination with reducing risks as well.
Courtney, how unique is this type of a program that you've built?
I think our program is very unique. The fact that we have the dedicated staff that takes care of all the details, that they schedule the CT scans, make sure people meet the criteria, get the authorizations from the insurance companies, and communicate with the primary care providers is really unique. Also, the fact that I'm trained as a certified tobacco cessation counselor is a unique feat as well. We also partner with a lung mass and lung specialty clinic so that if there is anything concerning finding on the CAT scan, we're able to get them plugged into a multi-specialty team approach to do rapid workup and diagnostics of the lung nodules.
Courtney, to make this screening program valuable, we really need to be able to better understand who do we target? Who's the ideal patient who should be considered for screening?
So the ideal patient is someone over the age of 55 and smoked a 30 pack year history in their life. but also in a good state of health, because the goal is that we're diagnosing cancer at a stage 1, and ideally they can have surgical resection. So it has to be somebody that you look at and think that they could tolerate a large lung surgery. They have to have not had cancer, any other previous cancer with the exception of skin cancers in the last 3 years, but in a good state of health that they could undergo a major surgical procedure.
We're getting close to the holidays. Do you have family coming into town, or do you go somewhere for the holidays?
I have lots of family coming in from town. My parents are on the east side of the state, and they drive over, and I have a brother who lives in Chicago and his children. So we'll have a full house.
What are some holiday traditions at the Lane household?
So I have 2 young girls, so I work really hard at trying to get new holiday traditions. We try to give them pajamas the night before and a new movie that we all watch as a family, and then wake up early morning to see what Santa brought them, have a big breakfast, and kind of have a more casual day, hang out as a family.
Are there any foods you need to stay away from over the holidays? Any treats?
I endorse all treats at the holidays. We're doing lots of baking, I think, this coming weekend, and lots of pies, things like that. There's lots of treats around our house always.
Well, Courtney, I thank you again for taking the time to come talk to me and tell us about this program. It certainly sounds unique, and it certainly sounds like it's providing value for our community. Thank you.
Thank you.